Let's talk about phosphatidylserine and the human brain. So this is a nice little review paper. You can see here the conclusion: phosphatidylserine required for healthy nerve cell membranes and for the production of myelin. This is the white matter around your nerves. It's what insulates nerves. It's what allows for nerve propagation. It's kind of akin to the coating around a wire. It keeps the wire insulated and it keeps the electricity flowing through the wire. And if you don't have adequate myelin, then your nerves will short circuit, just like your appliances will short circuit if the electrical cord has frayed edges. So aging of the human brain is associated with biochemical alterations and structural deterioration that impair neurotransmission. In other words, the cell membranes and the myelin, if those deteriorate, then the brain ages more quickly. Exogenous phosphatidylserine dosing from 300 to 800 milligrams per day is absorbed efficiently in humans, crosses the blood-brain barrier, so there's no impediment to getting to the brain, and it safely slows, halts, or reverses biochemical alterations and structural deterioration in nerve cells. And with all the onslaught of things that damage our nerve cells, what are we exposed to on a regular basis that can damage our nerve cells? Well, we're exposed to chloride and fluorine. We're exposed, many of you are gluten sensitive and have gluten issues, and gluten's a neurotoxin. Mold is a neurotoxin. EMF, electromagnetic frequencies, and radiation from all the devices that kids are being raised on today. These are all things that we know can impact healthy nerve function in nerve cells. The food dyes, the food additives, the preservatives, the chemicals, all these things deteriorate nerve cells. So what we're saying, 300 to 800 milligrams a day passes the blood-brain barrier, supports human cognitive function, including the formation of short-term memory, the consolidation of long-term memory, the ability to create new memories, the ability to retrieve memories, the ability to learn and recall information, the ability to focus attention and concentrate, the ability to reason and solve problems, language skills, and the ability to communicate. It also supports locomotor functions, especially rapid reactions and reflexes. It's a lot of benefit. Now, this is a review on the effect of phosphatidylserine in humans, coming from human trial data. So this is not speculative theory. This is actually what we see. Now, let's talk about some of the research on dementia or Alzheimer's. So effects of phosphatidylserine in Alzheimer's disease. It's a human trial. We studied 51 patients meeting clinical criteria for Alzheimer's. Patients were treated for 12 weeks with a formulation of bovine cortex phosphatidylserine, 100 milligrams TID. That's 300 milligrams a day, or 100 milligrams 3 times a day, but 300 milligrams a day. And what did they find? Most apparent among patients with less severe cognitive impairments, they found improvements in mental decline. And I highlight this on purpose. So most apparent among patients with less severe cognitive impairment. Here's what you're not going to see. So if you have a family member that's full-blown lost, they don't remember who you are, they don't remember who their family members are, this is probably not going to be super beneficial. If they're in really late stage cognitive decline, Alzheimer's, we're probably not going to see the tremendous benefit. Now, this is why it's so important to catch it early. So if you've got early cognitive decline, early Alzheimer's, this is where you want to go. I'd go 300 to 800. I mean, if you tolerate it well, we'll talk about some of the side effects in a minute, or potential side effects, but you're not going to see, and I haven't seen that clinically, the researchers haven't seen that clinically, you're not going to see the tremendous level of improvement in somebody with end-stage Alzheimer's where they can't remember family, friends, etc. Now let's look at this research study. Phosphatidylserine, this was one where they mixed omega-3 and phosphatidylserine may improve memory abilities. You see here 131 participants completed the study. At endpoint, verbal immediate recall was significantly improved in the phosphatidylserine DHA group compared to placebo. What they found were improvements in immediate and delayed verbal recall, learning abilities, and time to copy complex figures. The results indicate that phosphatidylserine and DHA may improve cognitive performance in non-demented elderly with memory complaints. Again, catching it early, catching it when those memory complaints are early onset, you're going to get far better outcome and far better benefit than if you wait till the cognitive decline is severe. You see this one, cognitive decline in the elderly, is a double-blind, randomized, placebo-controlled study for phosphatidylserine. You can see the therapeutic efficacy and the safety of oral treatment. And this was placebo versus 300 milligrams a day. And they carried this study on for 6 months in geriatric patients ranging from 65 to 93. And there were almost 500 people in this study. And what they found was statistically significant improvements in the phosphatidylserine treated group compared to placebo in terms of behavioral and cognitive parameters. In addition, clinical evaluation and laboratory tests demonstrated that it was well tolerated, meaning well tolerated with very little to no side effects. So the safety is very much good. 300 milligrams a day is the dose that was administered in this trial. So in this trial, it was kind of one of those, they were also trying to determine safety from long-term side effects. Then we have another human study. In this one, they were using a plant-based derived or a soy-derived phosphatidylserine, because you can derive it from animal products. You can also derive it from plant-based products. So if you're trying to follow a vegetarian diet. But you can see here for 12 weeks to 30 elderly volunteers with memory complaints. What did they find? They found improvements in memory recognition and recall and executive function and mental flexibility. Total learning and immediate recall improved. It was a secondary effect of the phosphatidylserine, but one of the other things they found was it reduced blood pressure significantly, both systolic and diastolic blood pressure. So that was an incidental finding. It wasn't a blood pressure study, but it makes sense because it's when you're improving brain function and brain blood flow, right? Remember I showed you earlier that one of the functions of serine is to help with heme production, and you can improve oxygenation to the brain. Then you can get an outcome which helps blood pressure. This exploratory study demonstrates that phosphatidylserine may have favorable effects on cognitive function in elderly with mental or memory complaints. And they gave the same dose, 300 milligrams per day in this particular study. Another human trial. The effect of phosphatidylserine containing omega-3 fatty acids on memory abilities in subjects with memory complaints. This was a pilot study where they gave omega-3 concomitantly with phosphatidylserine, and they administered it daily for 6 weeks to 8 elderly volunteers with memory complaints. And so what they found was in the supplementation group resulted in a 42% increase in the ability to recall words and the delayed condition. So, what do we have? We have several research studies done in humans showing improvements in memory and recall. We have study in kids with attention deficit hyperactivity disorder. And then we also have some research on serine in humans on the stress association. So in this one, you can see here, administration of phosphatidylserine. The neuroendocrine responses to physical stress have been examined in a placebo-controlled study in 9 men. Phosphatidylserine, they gave a higher dose. This was 800 milligrams a day, and it was done for 10 days. And what they found is it significantly blunted the adrenocorticotropic hormone and cortisol responses to physical stress. So it helped attenuate the stress of aggressive exercise. So these were healthy, active men taking 800 milligrams of phosphatidylserine and having a better stress response. The results suggest that chronic oral administration of phosphatidylserine may counteract stress-induced activation of the hypothalamo-pituitary adrenal axis in man. So clinically, we use this a lot. We use phosphatidylserine specifically to help people who are undergoing tremendous amounts of emotional or physical stress and find that it makes them more tolerable of stress. We find that it makes them less. Let me back up here because I want to just kind of help you guys understand something around stress, and then we'll come back to that other study. But when you have chronic inflammation, so when we think about stress, there's chemical stress, which is inflammation, And then there's physical stress, which is what I just showed you with exercise. And then there's emotional stress. And generally speaking, the body will not perceive stress differently, whether it's chemical, physical, or emotional. Many of you have inflammatory stress, the stress of inflammation, whether that's food-induced or microbial-induced or nutritional deficiencies that are inducing or contributing to heightened levels of inflammation. But when you have heightened levels of inflammation, you get increased cortisol. This is one of the body's natural responses to heightened levels of inflammation. Now, if the inflammation is acute, meaning short duration, immediate or just a few days, then your body recovers and it's not a big deal. It's where the problem sets in is when this inflammation becomes chronic. So we're talking about 3 days plus, 6 months, 12 months, etc. So this would be like people with bad diets, people that smoke, people that have lifestyle or behavioral problems that drive the inflammatory process. And so now what's happening is their ACTH from their brain. So what happens, that inflammation stimulates the brain to make ACTH, and ACTH then stimulates the adrenal glands to make cortisol. And then cortisol is produced. And cortisol does what? It reduces calcium, it reduces magnesium. So we're talking about micronutrient deficiencies. It reduces vitamin D, it reduces vitamin C, it reduces potassium. So all these things are lost nutritionally as a result of heightened levels of cortisol. But the other side effect of cortisol is it drives up blood sugar. It causes muscle loss. And it also causes bone loss, so bone and muscle loss. So we don't want this chronic inflammatory stress. And we don't want this chronic heightened level of cortisol. And this is part of the problem in medicine. When you go to the doctor and you're inflamed and he's like, well, let's put you on prednisone. And we see this a lot in people with skin conditions where they get a steroid cream that's predominantly prednisone, or we have somebody with an autoimmune rheumatological arthritis and they get put on prednisone for anywhere from, a month to 6 months, depending on the doctor and their experience. But now we've got this chronicity or this elevation. This is synthetic cortisol. And either way, it causes these same types of problems in humans. And so now you end up with these issues and your muscles degrading, your bones degrading, you're becoming more and more malnourished. And what do you think is going to happen with your ability to control inflammation and deal with stress when you're more and more malnourished? Of course, it gets worse. So where we'll sometimes interject and have really good outcomes is we'll use phosphatidylserine in people who have a severity of chronic inflammation coupled with a severity of intense emotional or environmental stress or post-traumatic stress, because we know that there is a mechanism of phosphatidylserine helping with this. Again, going back to the research studies that I'm pointing out here, you see this one, the effects of phosphatidic acid and phosphatidylserine on the endocrine and psychological response to mental stress. So I showed you a research study in humans where they're using it to reduce the HPA axis of producing cortisol in athletes doing exercise, but this one was particularly done on mental stress. And they were using 600, 800, or 400 milligrams, and then they used a specialized type of test called a triosocial stress test. And so what they found is that patients that were taking 400 milligrams, 600, or 800 milligrams all had pronounced blunting of both serum ACTH and cortisol. So going back to, this here, it blunted the outputs of stress. So basically helped modulate the stress response in those individuals. Now, ultimately, if you're going to use phosphatidylserine to support your stress, you don't want to just take a bunch of phosphatidylserine and ignore the stress. You need to come back and you need to address fundamentally the big why. Why is there stress? And so again, if it's emotional stress, people are intelligent enough, they can typically figure that one out. If it's food-based stress, testing can help. If it's chemical-based stress, testing can help. If you're over-exercising, taking weeks off, taking a week off, taking rest weeks, those kinds of things can help mediate or mitigate the stress. But you don't want to rely on phosphatidylserine for the rest of your life and then just run your body ragged thinking that this is going to fix the problem, because these are blunting effects that can be used in the short-term duration to improve quality of life. But what we don't want to see is a person becoming dependent on a supplement or a pill in order to have a blunted response. So don't take this message away and say, I'm just going to blast myself with phosphatidylserine indefinitely, but not actually address the issue behind the causation of the stress.